Dr. Walensky, let's talk a little bit about lower back pain, maybe sciatic pain and stuff, which might have come from an accident. It might not have come from an accident, but there it is, and apparently devastating people's life. Is there hope for them?
Sure. We can, at our office, we have a lot of people that have long-lasting pain. It could be from an accident at work or a car wreck. It could be from arthritis. And what we do is we can treat them with medication. We can treat them with steroid injections. We can do physical therapy. We can do chiropractic treatment. We have a multidisciplinary clinic where we have MDs and chiropractors. We can also, a lot of chronic pain involves a psychological component, because chronic pain makes people depressed. A lot of these people can't work because of their chronic pain, and that makes them depressed and anxious. So we have psychologists and counselors, licensed counselors. We have vocational counselors. We also have a chronic pain program for people with long-lasting back pain, and this is like a multidisciplinary approach. They have counseling, they have therapy, they have vocational planning, and that we basically have the full complement of professionals to help them.
Wow. So basically, they can get, what does it take on an average, a person with, let's just say, sciatic pain, as I mentioned, how long does it usually take to get rid of that? And is it really, can a person ever get completely rid of it, or is it just getting better?
Well, it depends on the person. You can get better in a couple of weeks, or it might be a lifetime thing. What happened to me when I was in med school, I was playing basketball and I herniated a disc, and it paralyzed my leg. And I got better with physical therapy, but this is like 30 years later, and I still have numbness and pain in my leg every once in a while, especially when I lift something I shouldn't be lifting, or do a sport I shouldn't be doing.
I see. Okay, but all right, good. I appreciate that. So that's what it is, and we don't really know that before. But have you seen that there are obviously ways out there to help a person who did have, let's just say, a year, 2 or 3 excruciating pain, that he at least gets to a level where he can function again? Is that, would you say, a 5% chance, or is it more like up there in the 60, 80, 90% chance with the right treatment, or apparently the right treatment, the type of treatment you provide in your practice?
If someone's been seriously injured and they've been off work for a long time, we can, our program has approximately a 91% success rate in getting them stronger and getting patients in the condition to go back to work. We've had people, they've been off work for 15 years and they were able to get a job after our chronic pain management program.
Wow. That's of course impressive. And again, those people probably underwent a whole one of your 28-day type of program, intensive, and get everything looked at, right?
Yes.
Okay. All right. Well, wonderful. Thanks a lot. It's very informative.